In this video, you will learn how to create a medical history form. Hi, my name is Liz. Don't forget to hit the like button and subscribe to my channel to get notifications of future content. Hi, today we're going to talk about putting together a medical history form. So the very first thing that you want to do is determine the purpose. So we want to decide what specific information we need to gather from our patients, considering the nature of our practice and the medical conditions that we treat. The medical history form should capture relevant details to help you provide effective care. Next, we're going to identify required sections. So this might be something that you need to reach out to a regulatory board about because there are some rules and regulations and laws as far as what you need to keep on hand as far as records go. So we also want to divide our forms into sections to make it easier for the patient to identify what's being asked, and include personal information. So ask them about their symptoms, how long they've been having the symptoms, how the symptoms have affected their daily lives and their activities of daily living, different things like that. Any kind of allergies to medications, of course, that's going to be a big thing, especially if you are the type that will be prescribing medication. You need to know so that you don't prescribe them the wrong antibiotic or cause them a severe reaction. Any kind of surgical history. So for me, I think I've had like 2 surgeries. And so I write down the dates of those and, what I had. And then, of course, tailoring it to your specific practice and, again, what you guys provide. This time, we're just focusing very specifically on the medical history of the patient. Though in the last video, we actually talked about the demographics section. So we're not going to cover any of that information. That form that you've already created, done, tested, and is ready to go should actually be attached to this medical history. So obviously you do want to have an entire section on this medical history for their detailed medical history. So you need to have comprehensive questions to gather information about past and current medical conditions, any chronic illnesses, previous hospitalizations, significant events in their medical history, things like current concerns or symptoms, previous medical diagnoses, past surgeries or hospitalizations, allergies to food or environment, current medications and dosage, immunization history, all that stuff that you need. So make sure to include either a large section for them to write it all out or actually break everything down. I think it's better if you break everything down because usually new patients are nervous about a new environment, new provider, things like that. And sometimes it's hard to remember your entire medical history. So giving them little prompts can really help in that way. The next thing that you want to cover in your medical history is going to be a family history. So usually we're talking immediate family, mother, father, grandfather, grandmother, brothers, sisters, that kind of a thing. And we'll actually showcase that when I show you just a sample form that I created at the end of this presentation. The other thing you want to do is ask them about their lifestyle, anything in their lifestyle that might contribute to their either health or disease. Food that they eat, their exercise history, smoking, alcohol consumption, dietary preferences, all kinds of different things. It's a real balance between making sure that you get all the relevant information and making sure that it's not a 30-page questionnaire. So definitely have to weigh each one of the things that you're going to put on there. So when you are creating your medical history, it's like any of the rest of the information in your welcome packet or your onboarding questionnaire. You want to review it often. You want to update it. Sometimes new laws come into play. For instance, HIPAA. HIPAA was a new law once upon a time. So new laws come into play. Sometimes there's outdated questions. Maybe you don't offer a specific service anymore, so you no longer need that question on the questionnaire. Again, make sure to review it. My recommendation is either every 90 days, take a look at it, or when something happens that's qualifying. So again, a new policy procedure comes out from the board or the state, different things like that. You want to test and refine your procedures and your questionnaires. And again, you can pick 5 people, 5 patients. You can hand this to them, have them fill it out, ask them what they thought about it. Was it easy for them to fill out? Did they feel like anything was missing? Did they feel like anything was redundant or too much? And then take that feedback and refine your forms. Something else to consider is actually including or incorporating electronic health records, EHRs or EMRs, electronic medical records, into your system. A lot of times they will allow you to actually create all of these forms within the system and then send a link to your patient to where they can fill all this out before they ever walk in the door. There's at least two benefits to it that I can think of. One, it takes the paperwork burden off the patient when they come to their first visit, and it also allows you and your staff to prepare for them when they're coming in, to look over the case for a few minutes and see what you're going to be dealing with when they come in for their first appointment. So those are just two benefits. Of course, there's many other benefits to that as well. All right, and so then let's take a look at a sample medical history. I just whipped this one together real quick in Canva. This obviously is not exhaustive by any means, but you'll see that there's a column for each of your family members, your mother, father, brother, sister, and self. And then it talks about, on this side, it'll talk about different ailments. I just kind of left this be, but things like heart conditions, diabetes, allergies, and then you would check each one. For instance, if my mother had allergies, and she does, I would check it. If my father had allergies, I would check it. If I have allergies, I would check it. So that kind of a thing. Again, this is just a sample. And obviously there's going to be a few more sections in this in the form when you get done with it. And just like the questionnaire, you can create this in Canva, Microsoft Word, or Google Sheets. As long as you don't store the patient information or the PHI in those systems, then you're totally fine to do that. So remember, it's important to prioritize patient privacy and confidentiality throughout the process of creating and storing medical records. A tip that I gave in the last video is when it comes to your paperwork that you can touch, or the real papers, you can put them on a clipboard and actually use a blank piece of paper on top of all of that information. That is one way to remain HIPAA compliant. And make sure that you tell your patient when they bring the clipboard back up that they need to replace it with that blank piece of paper to protect their information. All right. We want to make sure that we are minimizing risk and maximizing productivity by documenting it, delegating it, and getting it done. See you in the next video.